area that spans Europe, Africa, Asia, and the Middle East. So that's really who we are. We provide services today to a large number of leading media organizations around the world, as well as a large number of relief organizations. So this is the sort of pedigree of people that we try and assist. So what I wanted to talk about, there's a lot of text here, but what I really wanted to talk about is how we've seen the role of the journalist change. I mean, Facebook, YouTube, Twitter, these seem to be breaking news sources for people today, and that's really revolutionizing how news is being pushed out, how people reporting from Sierra Leone or Liberia are trying to get their news out. I mean, I think particularly here in the United States and Western Europe, Facebook and Twitter rank often more highly than leading news organizations. So, you know, what we've seen today is how professional journalists have almost taken on a role of curation, working with networks of citizen journalists, what we've sort of termed eyewitness media. So you have people who are out there in the field, you know, particularly if you think of the Arab Spring, a lot of that news that was coming out of places like Egypt was being recorded by kids with cell phones. And so the role of the journalist has had to adapt to take that information, put it in context, curate it, and then make it part of the wider story. And really, that's also putting a lot of pressure on journalists today to be in the front line. So, you know, gone are the days when CNN can send someone to Baghdad, have them sitting in the green zone. You know, the viewer wants to see the journalist where they are, break the news, and actually see them doing this. So what we see is that social media can be a really effective tool for doing that. Not only using Twitter to break stories, but also it can really help in disaster relief. I mean, we had some excellent examples last year during Typhoon Haiyan, where we were able to work with, you know, I'll use the example of CNN. They were out there in Tacloban reporting the news, but at the same time, the disaster agencies didn't know where to best direct their efforts. So they were using the information coming back from the field in order to help push where they would send the next humanitarian workers. And so there is this nice symbiosis between social media, the journalist, and the relief organization. Of course, you know, when you're in a relief area or you're in a disaster zone, you're not always going to be able to use social media, and we'll come on a little bit in a second as to how technology, and not just our technology, but multiple technology in the market today can actually make that happen. One of the things I would say is that it's very different using social media in a disaster zone to a conflict zone. I was talking to a journalist last week. She's a roving reporter for Al-An television in the Middle East. She has 87,000 Twitter followers, and she mainly breaks news on Twitter. Her name is Jinan Musa, and if you want to know what's going on in Syria, she's there much more regularly than many Western journalists. The problem she finds is when she goes into Syria, she's actually hunted. She's hunted using Twitter. So Twitter tells you your location. So there's a series of, you know, tips you need to go through, and this goes back to the preparedness, that when you're going into a disaster zone, clearly you want people to know where you are because you want to get that message out to the wider world. If you're doing it from Kobane, you probably want to turn off location services on your phone. So it's these very basic tips that you know, people need to be aware of, because obviously it becomes a completely different thing. So, you know, this is a bit of a plug for satellite. We obviously see satellite as not being limited in these disaster zones. You know, again, Haiyan is a good example. A lot of media rushed out to Haiyan with cell phones, with, you know, GSM technology, and all of the local cell phone towers had been wiped away. So that obviously, when you're thinking about your preparedness plan, you need to recognize that the one advantage of satellite is clearly its ubiquitous reach. We see it very much as complementary to the kinds of services that you offer today. And we're working very hard to pioneer this concept of bring your own device. I think we see it more and more in the office. People now bring their own laptops into work. We see meshing bring your own device with satellite as well, bringing it back to social media. So using an interface that you're familiar with, your own phone, and turning it into a satellite device. What's coming next? We're working on a really interesting project right now with NHK, with Google Glass, pairing your Google Glass to make real first-person reporting. So they've got this initiative running in Japan now where they've given 100 sets of Google Glass to activists, to relief workers, to journalists, and they're having them capture things live, and then the professional journalist sitting at headquarters is curating that information and putting it into context. So again, there's this nice relationship between social media, technology, and the humanitarian relief. So I'm going to just touch on it's a product we offer, but there are many products in the market like this. It's called the SAT sleeve, and this is how you can continue using your own device whilst you're reporting from anywhere in the world. Essentially, you slip your iPhone into the device, and it turns any iPhone or Samsung phone or BlackBerry phone into a satellite phone. And so this is, again, this concept where you're using an interface you're familiar with, you have all your social media, you have everything inbuilt to that, but you're able to have that ubiquitous satellite coverage. And so what we feel is that this really assists not only journalists in breaking news from where it's happening, but it assists humanitarian and relief organizations as well. You know, it's one of the other problems we see is obviously you go into somewhere like Syria and they don't want you taking in satellite technology. You potentially go into even a disaster relief zone. They don't want you taking in satellite technology. So we've designed this very much to look like an iPhone battery charger. There's a little button on the side. You flip the button, it starts charging your iPhone. Anyone asks, oh, it's an iPhone charger. And we've got some quite nice examples of people using it in these difficult areas. So, I mean, again, I'm not trying to plug our technology. This is what we offer. There are similar products on the market today. It's to get you guys thinking that bring your own device using the technology you're familiar with is something that the satellite industry is beginning to look at. And we would strongly encourage you as you go back to your newsrooms to start asking about how you can use this kind of technology as well. Not only is it helping you break news, but it's also keeping you safe and secure. This phone has an app. You hit a certain button in the app, it geolocates you immediately. Our emergency response center is notified. Your newsroom is notified. So Richard Engel was in Syria. He's the NBC foreign correspondent. He was using one of these devices. Something went wrong. He was in the process of essentially being taken. He was able to use this device. His security team was alerted, and fortunately, you know, that averted a difficult situation. So think of technology as a way of keeping you safe and secure while you're doing your jobs. This is the usual Thoreau nonsense. You don't really need to know that. I just also finally wanted to sort of touch on some of the things that we've done with relief organizations, specifically around Typhoon Haiyan. You know, again, this is all about how technology can facilitate partnerships. We work with an organization that people may be familiar with called NetHope. Essentially what NetHope does is, and this I think will kind of ties to one of the earlier sessions about the role between journalists and relief organizations and nonprofits. NetHope, who are based here in the United States, are an excellent organization that bring together both corporate partners, technology partners, media partners, nonprofit partners. And when there are situations like the one in the Philippines, they reached out to us. We were able to provide, you know, equipment. But if you're in a situation where you need that facilitation of the relationship, NetHope, I can strongly recommend reaching out to them because they have a lot of, you know, very, very good contacts. Last week, for example, where they got funding from Mark Zuckerberg to deploy 100 of our units into Sierra Leone so that the Ebola crisis centers could actually return data, because that was what they were saying. The biggest problem was data wasn't coming out. They had news reports, they had anecdotal evidence, but they couldn't get hard data out because they couldn't have that kind of information. So, you know, Zuckerberg thankfully stepped up, donated money, and NetHope facilitated a network of partners. So a bit of a plug for NetHope. I know I think they might be around at the conference this week. So if you're coming tomorrow, please take a moment to go and see them because they are a fantastic organization. So that's it from me. If anyone has any questions, I'll be here till lunchtime. So thank you. Yeah.
Thank you.
I'm Joan Maurer at BBG. John, could you talk a little bit about the costs of this satellite technology?
Yeah.
Because I think that has been an issue.
No, and I totally agree. I mean, I think no one's going to say that satellite and terrestrial have the same level of cost. What we're trying to do as a company is focus the satellite business on the consumer. It's tended to be business to business or business to large business. So what we've been able to do is really bring that cost down. I mean, I would say if you're using one of our devices, the cost per minute for a call is 2.5 cents US. So, yeah, I mean, we've really worked hard to do that. A lot of that's been driven by the relationships we have with people like mobile phone operations. So we have a deal here in the United States with AT&T. We have a deal in Japan with SoftBank. We have a deal in the Philippines with Smart Communications. And what that has allowed us to do is to sell in bulk. And that bulk has allowed us to, the volumes have allowed us to bring down the pricing. So, yeah, I mean, I think cost has always been the problem. We have definitely, our CEO is very, very focused on using technology to save and improve lives. And so for certain vertical markets like the relief sector, we do a lot of corporate social responsibility. So for the journalists, unfortunately, you're dealing with me. I'm going to make you pay. For the relief organizations, you can have it for free. So,
John, a quick question. Gustavo Wynn from Strategy and Development. We do a lot of journalism training overseas, particularly with citizen journalism.
Yep.
How do they benefit should the SATs leave, and how much is it cost for those citizen journalists in countries like the DRC, Congo, Cameroon?
No, you're absolutely right. And again, no, this is something that I was just at a conference last week called News Exchange in Europe. It's a premier conference for bringing together journalists from around the world, and I'd strongly recommend anyone who's in that field to look at attending. And one of the things we do is we partner with an organization called INSEE, the International News Safety Institute. We do that with them in Europe. We have another partner in Africa called the Manel Media Exchange. And so what we do there is we donate equipment. And we try and be part of that conversation, because for me, that this is great, you give this equipment to Richard Engel and he goes off, he comes home, but what about the person who's left behind, who's actually his guy on the ground, his stringer, his reporter? And I think, in general, what I see is that mainstream media is changing. They no longer will just use material from stringers without making sure that there's a certain amount of level of protection put in place for those people. I think a couple of years ago it was, we'll take whatever we can get. It's a personal opinion. And then, now they've recognized that those people are left behind. So we offer very, very competitive packages for example, what we do with one leading media organization in Europe is for every piece of equipment they buy, we donate one for them to give to a citizen journalist. So that they can use them in the field, particularly, for us in the Middle East, that's covering some of those stories in Syria. That's very, very important.
One more question. Sure. Sometimes video tells the story. Is it capable of shooting video?
Yeah, absolutely. Yeah.
Wonderful.
Hi, John. Abdi Yabara with the Somali Service. And on the case of, for example, Richard Engel, you gave that it's kind of giving him security and prevent him from being captured. Isn't it true also the other side that ISIS or maybe Shabab also will have and can maneuver on that? How you guys work on that?
You mean the tracking of...
The tracking of that, yeah.
I know that's a very interesting subject. And everybody's watched, US television programs where you get these boffins and they're tapping away on the computer and 3 seconds later, oh, we've located you. I can absolutely tell you that our satellites have been hacked in laboratory conditions using a supercomputer that took 48 hours. So if ISIS has a supercomputer and you're going to stand in a single location for 48 hours and transmit using the phone, then potentially you have a bit of a problem. But in day-to-day usage, the likelihood of tracking and tracing is I won't say it's zero, but it's very much slim to none. We also will give you some very specific techniques. In the examples where people have been found using satellite technology, the number one reason they've been found is because they haven't been aware of their surroundings. So they've been walking down the street using a satellite phone, and someone who works for the regime or someone who works for the government has very quickly spotted them and has contacted people that way. We use certain algorithms. Our largest customer is the US government. And our largest user within the US government is Special Forces. So our terminals are being deployed in Afghanistan, Iraq, Syria, and we have put in place very specific protocols for them, which we also now extend to our general customer base. That means we take off GPS features, so you can't see where the calls are being made from, you can't see the location of the phone. So we have definitely taken precautions. But if anyone does have specific questions, I have a white paper on that that can provide you a certain amount of information on how we nullify those problems. Oh,
Thank you very much,
sorry,
John.
Liz.
Just a quick reminder that we need to follow
Sorry.
the time frame of our discussion. If you have any specific questions to any of our speakers, they will be available here at 11:50. So you will be able to ask your specific question one-on-one or in a group. Thank you very much, John,
Thank you.
for your presentation. We would like to continue this discussion of the use of new technology in disaster relief efforts and invite here Gianluca Bruni, who is Chief of IT Emergency Coordination Branch at the UN World Food Program. Gianluca, you're welcome.
Thank you very much. Do I have to be on the podium or can I just be with them?
You don't have any PowerPoint, right? So
I don't.
if you want to be...
Do I need that too?
Yes,
I
please.
do. Okay, yes, ma'am. Yes, ma'am. Absolutely. I think my predecessors spoke in several occasions about those relief agencies and humanitarian responders. They gave you some tips. I'm one of those, so feel free to practice with me. All of those tips. Catch me, give me some of the tough questions, please. It will help me practice as well. There's 3 points that I'd really like to get through today. One is that information and communication is aid. 2, the role of the local communities in humanitarian emergencies. And 3, what we call the CNN emergencies. But today we'll call them the Voice of America emergencies. But I'd like to start just with a couple of tips. Again, I'm a responder. I've been operating in humanitarian emergencies for about 20 years. My first assignment was in Rwanda, 94, 95, and all the way to today, I'm part of the team that supports the eradication of Ebola. The expression that we use is to kill Ebola dead. That's our target. Throughout this time, we've been engaging with many of you down in the field. But keep in mind one point, and I think some of our colleagues mentioned that before. We think you're bad people. When you arrive into an emergency, I'm a responder. So I'm in Bandace, I'm in the middle of the tsunami, I arrive on the spot, I've got a huge task ahead. Before I can actually do my part, I need to start moving bodies, I need to start thinking about what do I eat, how do I build the infrastructure that humanitarian agencies will need to support aid, et cetera, et cetera. I'm in the middle of nowhere, I was just dropped there by a plane, and here comes the journalist. And now I'm totally terrified. And I start with the assumption that, to begin with, I'm not a media person. I'm a responder, right? I'm with the ICRC, I'm with the World Food Program, I'm with UNICEF and the lot. And my task ahead is to support children, give food assistance, et cetera, et cetera. And somebody arrives here, and my first thought is, how do I not get in trouble? How do I make sure that whatever I say doesn't end up in an article that says we're totally useless? Because that is what actually is going through my mind right now. I'm probably not prepared. I don't have a speech to give you. And I'll probably be going like, okay, what do I say now? How do I answer this question? So keep in mind that that's the first point. So when our colleagues before talked about building trust, absolutely. You don't have a lot of time to build that. And keep in mind that the person in front of you will be on the defensive. Of course, you can practice that with me too. Take people for lunch, take people for a few drinks. That's the way you build your connections, but that's the part you're familiar with. The main, and to me, most important tip, as a responder, like I presume all of you are, is if you're responding with somebody, prepare with them. We run a number of simulations, emergency simulation activities. We drop people in simulated middle of nowhere where there's no connectivity, there's no food, there's no water, and we tell them, okay, build the humanitarian operations. Go and join some of those sessions. I'm not saying necessarily come and do it with us, but do it with humanitarians. for a number of reasons. A, because the people that go to those trainings and simulations are the people that you're going to meet down in the field when you respond. So that will save you an endless amount of time in terms of actually building your connections. B, people will know you. People will see a familiar face and will probably, you know, that bad people attitude will probably fade at least a little bit. So to me, it's essential, not only because you'll have better tools, we spoke about safety, security, et cetera, you'll be better prepared there, but also you'll know the people that you'll end up meeting in the field. Now, eventually, onto our topic. Communication is aid, and I'd like to leave you, by the end of this session, with one question, which is, you're deploying those humanitarian emergencies with skills and with a task. Your task is get the story out there. Your skills are information. This is a skill which is essential in those operations. Think of the people in Port-au-Prince right after the earthquake. They were going to work, they got hit by an earthquake, the town is flat. What is their first question? How's my family? Where do I go for help? Where do I seek assistance? Are we going to be safe? How do we get to tomorrow? After that, there's everything that we as humanitarians think that they actually need. Food, water, et cetera, et cetera, et cetera. The first and primary need that people have in those situations is information. You're experts at that. So one provoking point I'd like to leave with you today is, well, while you're out there, can I ask you to wear for a minute a humanitarian hat and say, I'm an information expert. How can I lend a hand while at the same time achieving my primary task? People, as relief agencies, are waking up slowly with their own times, we're the UN, at the fact that information is aid. When there was a case just a few weeks ago that says when the internally displaced people in Iraq sought assistance, that's for food, that's for protection, that's for water, that's for medicines, and that's for cellular phone chargers. What does that tell us? There is an increasingly connected community out there. There is people out there who can start communicating with the rest of the world and make their own story heard. The role of those communities is going to change. And you know, when we speak about relief organizations and humanitarian operations and journalism, the first step is, well, get hold of us. My point is, get hold of them. Today, it used to be Syria up until last year. Today, do people really want to know about yet the next attack and a few more dead people? Am I on tape? And a few more dead people in Syria? Does that still hit the news? Ebola, huge coverage out there. Your challenge is, how do I come up with something new? Well, the way to come up with something new is to go where nobody else has gone and speak with those communities. They are the future of humanitarian aid. They are the ones who are going to make their story heard before you, unless you're a lot more proactive. Us, of course, come and talk to us, come and talk to me. But that's where, if we're talking about trends, that's where news will be. And still talking about what news is. I'm sure many of you are familiar with the camps like Dadaab, the camps that were built after or during the war in Somalia, all around, all the way from Kenya to Ethiopia, et cetera, et cetera. They've been there for 20 years. Is that news? Hardly. But the point that to me is important, and I'm a humanitarian, and that might make a story, is that they've been there for 20 years. What does that mean? It means that there's a whole generation of people, there's a whole generation of children who were born there. They are now 20 years old. They've never seen anything different from their camp. If they're lucky, they manage to go to school. But the rates of people that actually get out of school and then find a job is like this. There's no future for people in that camp. Is that a story? Is there a story there that says, look, this is what we can use. Using innovative technologies, using the Facebooks, using connectivities, we can give those local communities the tools to actually make themselves useful at a global level. The last point, before I start getting a timeout sign, is what we call the CNN emergencies. And again, I just use one example. There's plenty of emergencies out there. We can talk about Ebola, we can talk Philippines, Haiti, Indonesian tsunami, et cetera, et cetera. The CNN emergencies. It's where we get support because our voice is heard, because they hit CNN, and therefore support start coming in from the private sector, from the governments, from you name it. There's plenty of places, the refugee camps around Somalia, the Central African Republic, the Mali, where they don't hit CNN, but they're not of any less importance. That's where we actually need your support. That's where, I know I'm turning this into a request for help, but that's what I do for a living. That's where we can dig out stories and say, look, while the whole world, a few years ago, the whole world was looking at that tsunami in Indonesia, and the situation erupted in Zimbabwe. There was a big article in The Economist that was titled, While You Look the Other Way, because the whole world and the media were focused on one humanitarian operation while things started brewing and boiling until it became a humanitarian disaster. My hint is, while everybody is looking at one direction, of course, VOA will need to cover that, but start scratching the surface and start looking at the world where nobody else is, because there's news in the making there. Thank you.
Now, question time. We are so lucky. We have excellent speakers today who save us time for questions. Pardon?
Just a comment.
Oh, okay.
Just a comment. I think it's quite interesting, and that resonates very close to me because I travel constantly for our office doing training overseas. The first thing I tell people, I'm not going to teach you anything. We are sharing knowledge here. And to come to the next story, to go away from what is the focus now, one of the important parts of the journalist is to look at what is the story brewing. In an organization like VOA that speaks more than 40 languages, we are lucky enough that we have people on the ground that will speak Swahili or Sango or some of the strange languages in some continents and get there. But look at the humanitarian side. More often than necessary, I've been seeing cases in which the reporters intercede and interfere with the work of the rescuers and the humanitarian help because they haven't had that contact before to create a rapport, and totally agree with your position.
Thank you. That's an excellent comment, Gustavo. As a trainer on disaster preparedness too, I can add that we as journalists often fall for sensationalism. Like when we were reporting avian influenza, there was such a scare all around, and nobody was scared that more people die of smoking than of influenza. Nevertheless, we never reported in a sensational way to scare people off from smoking, right? So let's start with a little bit of questions, and I'm going to our own reporter. Please introduce yourself.
My name is Leo Kane of the House of Service, Voice of America. I would like to say that not all relief workers are bad as perceived by the relief workers. Because, let me not kill that. Relief workers in some parts of the world are bad, and we perceive them as such. Let me give you an example. In Nigeria, there's a consistent and permanent fight between relief workers and journalists for two obvious reasons: lack of trust and lack of transparency. Journalists out there see relief workers as people who corner relief materials. A lot of the materials that are given for distribution end up in private hands. And that creates a big, big distrust between these two groups. Now, when a journalist arrives at the scene of a disaster, he's not too concerned about what the disaster is all about. It's about what relief is arriving and how it is getting to the people. And I think that's his basic mission there. So when he finds out that these materials are not getting there, the story changes entirely into a corruption story. And that's what is going on in most of the undeveloped nations in the world. So how do you tackle that matter of corruption within relief workers? Thank you.
You need a microphone, right? I suggest maybe you use this
Yes,
microphone
ma'am, and you was
we'll
gonna
share
talk like
this
that.
with our audience.
Okay.
Thank you.
If I said that relief workers are bad, I didn't mean that. I meant that journalists are bad, just to be clear. Look, we work in some of the most complex environments around the world, and corruption is one of the issues that we deal with on a daily basis. There is security, there's lack of basic infrastructures, there's lack of communication infrastructures, there's dealing with governments that are suspicious towards us. And to be clear just on that point, we operate only and exclusively upon invitation of government. So when we go into a country, it's because the government has asked for our support, or there is no recognized government, and therefore Security Council resolutions kick in, et cetera, et cetera, et cetera. The point of corruption is very simple. We are very focused on delivering assistance. I won't deny that in a number of occasions we need to take the necessary measures to get food out there, whatever they might be. What we do, though, is whenever situations become impossible to deal with, what we do is we build our own resources. So, as an example, if we have challenges of operational nature in dealing with local operators at logistic level, we build our own logistic fleet. And we therefore, in situations where we find it difficult to work with local structure or local commercial operators, we take it on upon ourselves, and we take care of the full supply chain ourselves. Did I answer your question? Is that
Thank
a
you.
bad
Thank you,
question to answer?
Gianluca. One more question here. Young lady here, please come over here so that Gianluca sees you. And please introduce yourself.
I'm Eskadiatu Kontabohiri. I'm originally from Liberia, and I currently live in the U.S. I have a couple of issues, but I would just limit it to probably 3. The first and foremost is, how do we quantify, or how do we differentiate the fact from fiction in reporting? Because when the Ebola thing came here, the way it was reported and the news we were getting from back home, which was unfiltered, was different. And even this VOA we are standing in right now, this institution do not report in the U.S. It reports outside the U.S. Al Jazeera used to be unfiltered. Now it's been filtered. The CNN that we watch in Africa is not the CNN we watch here. And as one of my professors once said, information is like a knife. In the hands of a surgeon, it saves lives. But in the hands of a criminal, it's going to destroy life. So now we have Ebola. Ebola is going away. The problem we're having now is the stigmatization that will remain. Even us Liberians that live in the U.S. here, we were being stigmatized. Even though we are Americans, still we're being stigmatized. That is one thing. Another thing is, when you are in Africa, because I did media training, I was a reporter for over 15 years, then I joined the UN Public Information Media Training. The thing here is, you see an NGO, a non-governmental group, they will come in, okay, we hear our budget is 2 million. But when they leave, if you go back to estimate the work they have done, you get to realize out of that 2 million, they have used maybe 1.8 on logistics, salaries, and at the end of the day, the local person on the ground did not benefit. Yeah, what I want to know, why do they have so much gatekeepers in the NGO system in giving out information? Because if you don't give out information, you're talking of trust. How will we trust you when you don't give out the information we need?
Thank you. Thank you for your
Thank
questions.
you.
Very clear, thank you. And just before I close, remind me to please give you another tip in terms of fast deployment. Unfortunately, this is one of those areas where I need to throw the ball back at you with a little almost disclaimer. At the beginning of emergencies, I think one of my predecessors also said that, there's total chaos. And when there's chaos, we don't want to tell you, and we don't want to give you, let alone the public, the impression that we haven't got a clue. The truth is, during the first day of Port-au-Prince, or during the first day of the Philippines, you name it, any emergency, during the first hours, or it can be days, or in the case of Ebola, it can actually be weeks, if not months, because we spoke before about the first alerts. The truth is we haven't got a clue. It's as simple as that. Again, we practice, we prepare, we make contingency plans. If we're lucky, the emergency is going to erupt in a place where we have a contingency plan or emergency response plan. The truth is, emergencies never do. We prepare for an Haiti type of scenario. We have the Philippines. That was, I think, one of the reasons why it was very successful, is that we had plenty of lessons out of the Haiti natural disaster into the Philippines. It was also successful because it was in the Philippines, so make no mistake about that. And then we end up in an Ebola type of situation, which is something that none of us ever prepared for. The closest that we ever got was the avian flu modeling and preparedness. Truth is, totally different, yet again. So the bottom line is emergencies are always going to be very different. Generally, as much as this is what we do for a living, they're going to catch us by surprise in their nature, in their type, and in their combination of humanitarian, security, economical, and political factors. And during the first times, we haven't got a clue. So I'm throwing the ball back at you, saying, look, because we don't, we are going to build those defense mechanisms. And we're going to try and make sure that we don't really tell you, look, I don't know. And it's up to you to build that relationship with us so that we can go to the next step. Look, the truth is, we don't really know, but this is what we're going to do about it. And if I may use the last 30 seconds, I work for WFP, World Food Program. We're in 73 countries. We do food assistance. We also do logistics and IT. Why is that important to you? Because I believe in your job you do three things. You speak to people and or get information. You move around and you send those news back. In terms of speaking to people and getting information, that's your job. I won't tell you how to do that. In terms of moving around, probably many of you already used some of our services. It goes by the name of UNAS, Humanitarian Air Service. It's a passenger service that we build in humanitarian emergencies that could be very handy to you because we go where commercial lines go. I'm not trying to sell you anything. We don't make money out of it. I'm giving you a hint. If it's there, use it. Look for them and use it. The third, we lead the humanitarian community in terms of IT. When it's time to send the news back and you have your Turaya, but you need to upload a video, or look for us because where we are, there's connectivity. Thank you.
Thank you, Gianluca, UN World Food Program. We'll have Paul Cropper, Global Lead Military and NGO Sector from Philips Healthcare, who found a very interesting and very up-to-date the question that young lady from Liberia asked. And he would like to make his presentation, which in part continues response to her question. So, Paul Cropper, the podium is yours.
Well, good morning, everybody, and thank you for letting me attend here today. I'm responsible for all our military, international key account management group, and also our disaster relief group. And what that entails, it's working with organizations globally. We have a very, very high level centralized governance, but also local execution as well. So it's always very, very important to use local partners. So what is our vision in Philips? We're looking to make the world healthier through sustainable innovation. Innovation can be products, but it can also be commercial innovation as well. What solutions can we make available to people? And our goal is really to improve the lives of around 3 billion people by 2025. So Philips itself was split up into 3 sectors. We've got lighting, healthcare, and consumer lifestyle. We have around 115,000 people working for us. You may have seen the press announcements recently. We're going to go into 2 companies. We will have healthcare and consumer lifestyle as a part of what we're calling health tech. And the reason for that is a part of the care continuum. How can we prevent disease happening? What we take for granted in healthy eating, healthy lifestyles we have, dental care, a lot of these other countries don't have that. So how can we prevent disease happening? Healthcare itself, we have around 37,000 people. You can see the split here. Historically, there was always a large imaging company, so that's the big heavy iron equipment. Looking now towards what we can do in terms of customer services. And our customer service portfolio is not just about servicing the equipment, it's financial solutions. How can we make solutions, commercial products available at a controlled cost? So if we look at our sort of innovation, our strategy, there's 4 or 5 key pillars we put here. People are at the centre of everything we do. We do address global challenges. We leverage our capabilities, but the key thing we do is we collaborate with others. There's far more we can do collaborating with other thought-leading organisations than what we can do on our own, and certainly in the domain that we're talking about today, in the context we're talking about today. And as I said here, innovation goes beyond products. It's also the commercial side as well. So we develop solutions to deliver more advanced care where it is needed. So, as I said before, we do work with partners. And if you can take this care continuum being what happens in the Western world, and we all take that for granted. You know, we get poorly, we get sick, we go and ring our own doctor, we go to the hospital, and we have a very correct state of how our treatment is from the point of injury, point of care, right the way through to recovery. What is absolutely key is the sustainable part. And when I say sustainable care, if we build a healthcare facility in some of these remote places, how can we engage with that community to make sure that's sustainable? So when we move away, the community has all the skill sets required to carry on delivering that. If we don't do this, it'll fall down. So some of the key things we do, you know, look at the medic packs we have, very, very robust, advanced trauma care. These go from the point of injury. We do a lot with the US military, a lot with NGOs as well, and we sell these right throughout Europe, very robust. One of the key things we think is absolutely key on the care continuum is looking about data transmission. So when something happens at the point of injury, we have solutions which we have developed with industry that will actually monitor the vital signs. Those vital signs are then transmitted via satellite link to various hospitals around the world. Depending where you're on the care continuum, you can actually get the images. So you could be a doctor in a restaurant, and you can get the images of the patients on your iPhone, and that could have been sent from a hospital or a remote facility in Africa. Diagnosis, absolutely key. We all know the earlier we can diagnose people, the better it is to improve and save people's lives. We need to look about how we can put innovation closer to the point of injury to get people treated and diagnosed as quickly as possible. We've done stuff with CT scanners. We've done stuff with our ultrasound systems as well. I'm going to talk 2 examples now. One is what we've done in the military to collaborate with industry, and then what we've done in terms of local governments in Africa. So when we look about working with the military, it's all about developing a life-saving solution. You know, and this is something, you know, great things happens in pubs, don't they? I was in a hotel bar probably 4 or 5 years ago, waiting for one of my colleagues to come down, and watching the news, and it came up, another person has died in Afghanistan. Looking at all these injuries, looking at the IED attacks that go on, explosions. Limited opportunity to diagnose people. How could we work together to take our solutions closer to the point of injury to give those soldiers the best chance of survival? And these are people that are our loved ones. It could be someone's son, someone's daughter, whoever it may be. So how could we take that innovation closer to the point of injury? So we spent a lot of time gathering insights, speaking to people like NATO, speaking to other thought-leading organisations. How can we work together to see what are the challenges, what are your pains, If we're going to develop a solution for you that's fit for you, you have been engaged with us. We've pulled you towards us to say, this is what we're looking to do. Do we understand your challenges? And also look about how we could create care and look about what we can do in terms of influencing outcomes. So this is something we've done with a company called Marshall's Land Systems. We developed a bespoke deployable CT scanner, which can be dropped off and is up and running within 2 hours of deployment. It meets all the NATO standards. It meets most of the military organisation standards around the world. We have the framework contract for NATO. Last year, we put our proposal forward for the Queen's Award for Design and Innovation. What the Queen's Award for Design and Innovation, which you can see the logo here, any of the Queen's Commonwealth countries who felt they've done something very innovative that addresses issues for people, you can put yourself forward for the Queen's Award. There was 12,000 entries were put forward. Philips and Marshall's got the award. And in the news, it was described as a knighthood within industry. 12,000 applicants, one winner. And it just goes to show, when you have 4 leading companies coming together, understanding the needs, understanding people's pains, people's challenges, putting the people at the centre of what we're doing, you know, guys, there's a tremendous amount we can do. The other one it's talking about is what we can do in providing sustainable care in the community. And I was very interested to hear the lady's question before, because this is really what we do as well. We've talked about the military side, let's talk about the community side as well. So if I look in Africa, you know, certainly the sub-Saharan African countries, we know they're not going to reach the Millennium Development Goals. We know there's huge issues with the state of the healthcare system. People don't have trust in the clinicians there. A lot of cases, they don't have clinicians, they don't have the capability. So what do? Something will happen. We would go to the hospital. We understand I can go to the hospital in Washington, for example, and I will get the right care. People are looking then to say, well, I don't have faith, I don't have trust in that. I will bypass that hospital, or that point of care, what we would call primary care. I will look to drive 100 kilometres or 100 miles to another hospital, put a huge burden upon that hospital. That's unsustainable. So the only way to get that to improve is to look at how can we develop primary care facilities in these countries. And those facilities have to be able to be, not just put them in place, how can we ensure that capability is sustainable? We came up with a concept called a Community Life Centre. And this is a very modular-based approach. It's been built by the community, engaged by the community. We have done all the planning with them. We've put all the solutions in there as well. And it becomes a community hub. And when we started looking at all this, it's not just the healthcare facility we're looking at. You look at communities in certain parts in Africa, they have no lighting. They have no water. They can't buy food. Or they can't buy healthy food. So we could take a step back and say, we could provide you guys with the absolute state-of-the-art medical equipment. But that's only part of it. You've got to have the right infrastructure in place. So we put our first pilot site in with the Kambayu county government in Kenya. This is a totally integrated solution. We have solar power in there, solar power lighting as well. So we work with partners who can provide that. There's water purification in there as well, so we work with partners to provide that as well. We have LED lighting. We've also what we call lighting the community in that as well. And when we say lighting the community, that centre in an evening is used as a community gathering. So you think about it, you've got children who can go there to play as well, floodlit areas. Social activities take place. So we've looked just beyond it being just a hospital. How can we impact that community? And I think one of the things someone was talking before was the IT solutions. Again, that's what we develop as well. We have our strategic partners we work with to ensure information can be anywhere in the world at any one point. Don't ask me how that's done, by the way. I'm not an IT guru, so. But I touched on this before. It's a holistic solution. you know, Philips, I keep saying, are a big company, but we cannot do this on our own. We have to work with partners who are wanting to look at taking a smaller piece of a bigger pie, but looking to say, not necessarily driven by profit. You know, how can we look about delivering sustainable capability that when we move away can be run, led, and managed by that community? And that involves training, so having dedicated and ongoing training programs for people. So a doctor will come in, a nurse will come in, and they will move on as well. So how can we ensure we have training for those people to be kept up to speed all the time? Looking about the technology that's in there, looking about how that's serviced remotely. So putting flags in as well. If something happens, we can diagnose that remotely before the people that are using it actually know the fault has occurred. And it's also revenue generating as well. So looking the other side of the fence, revenue generating for that community hub. We have a community shop there, we have water there, we have food. We're expanding that now and making it modular, so look, we can take that solution, expand it a little bit further. So working with the UN, looking about the Every Woman, Every Child programme, where we have committed that we will improve the lives of 100 million children and women by 2025, is looking about what we can do with these centres to put in there, you know, for people to have children where they can eat children at birth. And at the moment, we do about 2 per day here. We're going to ramp up exponentially. We're also working very closely with the UN to say, look, we will look to see how we can get funding with the UN and the UN Ops. We have our own CSR responsibility. We have our Philips Foundation, which we work very closely with the Red Cross. So how can we collectively go and target some of these organisations like DFID, like CEDA, like NORAD, looking about where they have social economical fundings, to say, look, can they invest into these type of solutions? So, for myself, and it's very close to my heart, we have great technology, but we want to do things far better. We want to do things far more, looking for that complete care continuum. Looking not just what we take for granted in our communities, but some of these other communities that don't have that. And I don't know if you've ever been to hospitals, certain hospitals in Africa, and you're looking at the state of the healthcare systems there. Go to a hospital in Washington or Chicago, it just can't compare. So it's looking to be how we can collaborate with industry, governments, looking about private healthcare groups, and other commercial organisations as well. So it's pulling everybody together and saying, look, together, collectively, we can do absolutely fantastic things, great things that serves the communities, serves people, treats people, all that great, great stuff, and together as a group, we're far more powerful than one company. And if you're all industry now, my next question I always say to people is, look, you've heard about what we can do, how can we, as industry, work together to really save and improve people's lives?
Thank you so much, Paul, for your presentation.
Thank you.
And I have, I think, a logical question based on your partnership chart. How come media is not part of your partnership? We are the closest way to the public, right?
Well, it's a good question. It's a, I think Philips, it's a, I was going to say a typical Dutch company. And if you look about what they do as an organisation, they're not a company that keeps going on how well they've done and what they've done. The view from Philips is a lot of our business is referral business. If we've done great things, it's the word of mouth that people find out about it. Yes?
Did you ever try how to integrate with microcredit? Because you talked about the community-based revenue generation.
Sure.
Okay. No services can be continued with grants. The days are coming over. Okay. But I'm glad that Philips is not only interested in disseminating information regarding their products, also services, plus to make it sustainable at community level. But how to empower communities so that they have purchasing power?
I think that's a very good question. I think we're not at that point yet. As I said before, this is the first pilot. We're in discussions with the UN Ops and other organisations about doing that. But I think as we move forward, that has to be one of the things that's brought in and taken into account. And that's making that community then more sustainable.
Thank you very much, Paul. We'll have more opportunities for Q&A during, like, in half an hour. But we need to move on
Okay.
now with Bernardo Valenzuela, because very important part of disaster response, of course, is transportation and logistics. And that's what his company, Terranova Global Training, does. So, Bernardo, the floor is yours. Where's Bernardo? Huh? Well, someone is missing in action. Let's go to Sam. Yes, Sam Bandit, research analyst for domestic disaster response at National Defense University. How to better engage the communities and local governments. Sam, please come here. Oh. Oh, towards here. Perfect. And show. And let's give. Okay. Come on. 1 second. Sam. Here it is. There we go. Please speak in the microphone. Thank you.
All right, thank you, Ina. I'm glad to be here. My name is Sam Bendit, and I represent National Defense University here today. And today I'll talk to you about our experience, our thoughts, our conclusions, and our advice on how to better engage communities and local governments in disasters. I'll tell you a little bit more about what we do. I am part of a project, actually overarching program called Civil Military Activities Integration, which is housed at the National Defense University here in Fort McNair in Southwest DC, just a short distance from here. National Defense University itself is part of the Department of Defense, and it is an institution of higher learning for senior military and government officials who are interested in learning more about security, defense, technology, and other matters. My program is based in one of the research centers at NDU called Center for Technology and National Security Policy. One thing that you'll hear today a lot is acronyms. Department of Defense loves acronyms. So Center for Technology and National Security Policy, or CTNSP, houses my project, CMI, Civil Military Activities Integration. We are part of the 4 pillars of the center that also deals with innovative learning, emerging challenges such as cyber, space, autonomous drone systems, and science and technology. CMI, my project, works to support building partner nation capacity, humanitarian assistance and disaster relief research, stability operations, and defense support to civil authorities domestically. So we work with a variety of domestic American and international partners dealing with larger issues related to disaster response. CMI specifically focuses on engaging whole of government, such as Department of State, USAID, DHS, FEMA, or international partners like United Nations, World Health Organizations, and many others. We're working with non-government organizations, businesses, and other partners, all of whom are responsible for delivering aid to affected populations. Specifically within CMI is a project of which I was part for the last 5 years called TIDES. TIDES stands for Transformative Innovation for Development and Emergency Support. We were originally stood up by the Office of Secretary of Defense for Policy and Acquisition, Technology, and Logistics, 2 offices responsible in DoD for formulating policy and looking into technology solutions for the military, so that we, TIDES and CMI, could be dedicated to open source knowledge sharing to promote sustainable solutions to populations under stress in a post-disaster, post-war, or impoverished settings. TIDES as a project supports 4 DoD mission areas, 4 Department of Defense mission areas, and we have seen those missions implemented over the last couple of years with Ebola, with assistance to the Philippine typhoon, to the Japanese tsunami and many other crises. We support humanitarian assistance, disaster response internationally, defense support to civil authorities domestically. We work with National Guard and the reserves. We work on building partner capacity and on stability, security, transition, and reconstruction. What we are is a research center. There are several staffers funded by Department of Defense who are looking into private sector, non-government, non-military solutions to disaster response. So we look at integrated research, outreach, information sharing. We support rapid fielding in several theaters where crises happen. We support ongoing crises and current events, and we do technology demonstrations and displays. Central to our research is a vast network, which I already mentioned. This is actually an older slide. There are more than 5,000 members active in disaster response in the United States, internationally, private sector, for-profit, non-profit, military, and civilians. We tap into this network for a very specific reason. We're interested in how disaster impacts local communities and how disaster response impacts local communities. We're looking at sustainable support, meaning we're looking at solutions which can be maintained and carried over by the local populations after international aid is delivered. All too often, technical solutions like shelter, like power, like water, like many others that arrive in the affected areas cannot be sustained by the local populations. They're too expensive, they're too technologically sophisticated, and either they are wasted or they have to be brought back with those who delivered aid. So we're looking at simple solutions, and we're interested in how local communities are affected and what they must do, what they should do to sustain the technology. Therefore, we relay that information back to our partners in the Department of Defense and across US government in letting them know what kind of sustainable solutions are needed by the locals. So I know some of you have reported on disasters already. I'm not a journalist myself, and my center doesn't deal with journalists. But what I'm about to tell you next extrapolates our experience, and hopefully it will be of use to you when you cover next set of disasters, natural or man-made. You, as journalists and members of the media, should be in constant training and discussion before disasters strike. All too often, you have a lot of aid arriving in an affected area, and people don't exactly know what to do besides their own mission. They have not communicated with other agencies. They have not communicated with other potential partners. They don't know the exact situation on the ground, except for that there's a disaster and people need something. We have learned in our project and in dealing with our vast network of disaster responders that at the local level, civil society, religious leaders especially, law enforcement, and community leaders are already engaged in a variety of social, economic, and other alliances. So it is essential to tap into these networks, to map out a plan and ready ourselves between disasters. We have to learn to be familiar with technology, not just the technology that you as journalists are using, but other technology that's available in the field. Dedicated radio frequencies, geospatial information systems, or crowdsourced information sharing and analysis. New organizations and efforts stood up in the private sector to help people orient themselves in a disaster, such as Ushahidi, Humanitarian OpenStreetMap, and many others. I know that VOA engaged Humanitarian OpenStreetMap for training in Indonesia, and that was a true eye-opener for both sides. Are there also waivers for equipment and technology so that local disaster responders can gain quicker access? Meaning, is there something you can bring to help local community orient themselves better in a disaster? If there's no shared system for communication, what can you do to enhance communications in the affected area with your own capability? We have learned that oftentimes journalists become true sources of information, and that they are best equipped to disseminate information much, much better than some of the local or federal governments in the affected areas. Journalists need to be advocates for cooperation and collaboration, providing coverage and good news for the communities. Because in the midst of enormous stress, you, as journalists, should However possible, celebrate disaster response successes. Your actions will mean that media is taking focus and recognizes significance of various and oftentimes competing relief efforts. You shouldn't wait to cover something until it happens. Best ways to get information out to the people is through community religious groups. This is especially true in regions of Africa, South and Southeast Asia, because they can do it in ways that other parts of civil society cannot. You should find out what is happening at the very local levels and drive the message home through a variety of means, since different audiences at the local level receive messages in different ways: print, electronic, or radio. One specific example I can cite is that after Japan earthquake and tsunami several years ago, it was discovered that the best way to deliver news to people was through simple Wi-Fi radio, that internet and many other means simply didn't work. So you as journalists already know what you can do. You should tap into what the localities need and what you can do for those local communities. You must hone in the message of disaster preparedness. You should explain to the local communities or your broadcast audiences, whatever they may be, what supplies will be set up and where after disaster strikes, where nonprofit groups that deliver those supplies are located. You should explain and describe the available resources and do it on a regular basis so that it becomes part of your concept of operations. Explain all this in an easy language for people to understand. Finally, I'd like to ask you as journalists and VOA in general if there's a kit for disaster scenario. Things you must do before disasters, during disasters, post-disaster, in a reconstruction phase. Are there specific steps you should, must, and are thinking of undertaking that have been pre-planned? It is essential to find out what the local communities are already doing and how they are organizing, because oftentimes the local community is the first line of defense and response in a major disaster. And you as journalists should, however possible, broadcast that out to let the people know that efforts are always underway to prepare. Finally, you members of the media should be receptive to feedback and have open channel of communication so that local communities know that they can utilize your resources to get necessary information back to their people. These comments and suggestions are an amalgam of various conversations we've had with our partners. So we've approached our partners in the DoD, we approached our partners who work on public-private, public-public cooperation. We approached some of the members of our network who have deployed already. So although some of these comments may seem general, you'd be surprised how often members of the media tend to skip these important steps on engaging the local communities. Once again, I'm Samuel Bendit. I work at NDU. I'm a member of Department of Defense. And I'm here to answer your questions and to deliver our knowledge back to you. I look forward to your questions and, most importantly, comments and suggestions. Thank you.
Thank you, Sam. So I have two great news. First of all, Sam was so up to the point. We have a few minutes for your Q&A. And we also have Bernardo Valenzuela to talk about transportation and emergencies in disaster response efforts. So let's ask Sam a couple of questions, then we'll give the mic to Bernardo, and then we'll continue with our last segment of this session, your Q&A, your opportunities to ask experts the issues, the questions that are of interest to your audiences. So, question for Sam Bendit, please. Please introduce yourself for Sam.
Okay, again, my name is Hassan from VOA-AIDF. My question is general, it's not content specific. Will there be a chance to get copies of the presentation, the content, presentation?
Yes, we'll post them on the BBG OSD, Office of Strategy and Development website, all PowerPoint presentations, if our speakers don't mind that.
I don't mind.
Thank you. All right, any other questions? No, not at this moment. Then we'll turn the floor then to Bernardo Valenzuela, President of Terra Nova Global Training. And I will activate your PowerPoint.
Good morning.
There you go.
Is this shall I,
Okay.
how much time do I have? Like 5 minutes or so?
Well,
Maybe
we'll give you 10. We'll cut you
10,
some
we'll do
slack.
10.
10 minutes.
Well, let me introduce myself. My name is Bernardo Valenzuela. I'm the president of this company named Terra Nova, which basically we devote our time and efforts to design first responder and emergency vehicles with a social with a social stamina in our approach. If you think about what it's, and I'm going to talk about a specific vehicle that we're going to be presenting and introducing in this event, which is called the MPV, the multi-purpose vehicle. You know, when we talk about disaster reliefs or permanent water requirement solutions, there are many problems, and those problems, it's very difficult to resolve them with a holistic approach. There are many situations like budget being number one, number two, requirements or bureaucracy, lack of studies or accurate studies, and sometimes environmental issues. And I'm talking about rural communities where a disaster or the needs for potable water, it's a major issue. So Terra Nova is going to be presenting this vehicle, and you're going to see it tomorrow and the day after tomorrow in this event, which we call the multi-purpose vehicle. And you know, when you deal with an effective emergency management vehicle in the US, you don't have one vehicle, you have several vehicles attending this situation. But when you're talking about Central America, Latin America, Africa, or other third world communities, we came with a solution which is the MPV. It's basically a water purification module with a medical mobile unit and a firefighting unit, 3 in 1. And the whole concept around this is providing these basic services through mobility. Doing more with less resources, or maximizing the efficiency of an investment of an asset of a capital asset that it's intended to solve and increase the quality of life of people during emergencies, or again on a normal way of living. And I will try to explain that. So, you know, I know that you may be more experts than I am in terms of water and water crisis, but you know, by 2025, 1.8 billion people in the world will be living in a situation where water is not accessible, or there's no clear path to find water. So, and again, fixing this problem will require a tremendous amount of resources and commitment to generate the wealth to invest in those resources. Our approach with the MPV is that if people get access to medical care, water, and firefighting to protect assets like harvest, they will have more time and quality of time to develop, to invest in their economic activities and generate growth. I brought a couple of examples. This is one of the applications, and I thought randomly places where we do some work. This is La Guajira in Colombia, which is a place in eastern Colombia that has very limited resources of water. And basically, this vehicle can touch base once a month in 12 or 14 communities, municipalities that will have 10,000 or less inhabitants to provide this basic service. So when you need to do it every 15 days, you need 2 vehicles. If you need to do it every 10 days, you need 3 vehicles, rather than, and this vehicle has the capacity to potabilize 5,000 gallons of water a day. So this is one application that we have for this vehicle. And then we're gonna, my most important approach is why, or how can we do a PPP investment with the approach of a multi-purpose vehicle. So we basically, I brought another example. This is in Mexico. Terra Nova will design and provide this vehicle with filtration. I'm sure that you guys know that water filtration needs are very different in different parts of the world. So I'm not planning today to talk about the specific application that we're going to bring, but as this unit will require tailor or modification, we are partnering with a company named Darley to develop that application where we can fix most of the needs of water purification, like 80% of those, not 100%. So how does this model work? This is the National University of Mexico, the Faculty of Medicine, and every year they graduate like something like 8,000 to 9,000 doctors that need to go 1 year for a social service year. So the second is the state of Mexico, which is the largest populated state in Mexico, with more than 200 municipalities, and many of those will match the criteria of 10,000 people or less. And as Sena said, it's quite interesting organization. This is the private emergency contingency center, and it's an NGO that will fund with the state of Mexico the acquisition and operation and design of the routes for the MPV. And this vehicle will work in it will help us to fix two things: a natural disaster and a first responder, where at the same time the vehicle could start potabilizing water and taking Medicare for people at the same time with the same investment. Or number two, they can do the route, as I explained, the one in the Guajiro in Colombia, for all the municipalities of the state of Mexico. So the vehicle works in two dimensions. And of course, the most important attribute is that it brings a high utilization rate to a normally high expensive asset that is very difficult to develop and use in many places that we know. So the rest of the presentation, it's a little bit more of explanations about the MPV, but basically describes this concept of delivering basic services and social stability to any community, the concept of doing more with less resources. So we believe this is a new, for some reason, nobody has thought about these three applications in the past. And when we designed this vehicle, we received a lot of feedback about how truly are these applications world-class. And I'm proud to, I own the idea, but I'm proud to say that this vehicle, and I will really like to hear your feedback in the next coming days, has a world-class design and quality of services design in the three applications, okay? So this is technically the purifier unit that we're bringing. It's one solution of many of the requirements that the water purification will need in the world. But as I told you, this can clean 5,000 liters of water a day. And the vehicle will have some folding tanks that will secure a perimeter in a post-disaster situation to secure a perimeter where population can receive water, and then the vehicle goes to the center of that perimeter to provide more purification of water and basic medical services or care. So final remarks on the MPV. It brings social services. It gives an access to people who graduate from medical schools and creates jobs. It has flexible options on the technical side to potabilize water. It could in the future, and not in the future, as an option to provide telemedicine, and where with an internet connection in a foreign location, a doctor can provide to a subject matter expert the results of analysis or Medicare, so the expert, subject matter expert can return that to the on-site situation. And most importantly, we thought about a sustainable. This vehicle on the mechanical and truck side will require something like $20,000 to $22,000 of operating expenses. And basically, the idea is when this vehicle is in the base, it's basically going to be a water plant, a bottling plant that through the channel that this process is organized, it will sell water to offset the cost of operating the vehicle. Sorry for the rush, but this is the basic idea, okay? Did I make it on time?
Thank you. That
Thank you.
was excellent.
Thank you.
So, and now, before we proceed to the best part, the mingling and you guys talking to experts and basically benefiting from each other's ideas, comments, questions, interviews, do whatever you want here. I want to express our appreciation to our partners, Aid Forum, who helped us organize this event, and also to all our speakers. May you please come to the forefront. We have a token of appreciation for all of you. Please. Thank you. No, please come. So, these are the Voice of America t-shirts that we hope you wear. Not only during the disasters, but during the peaceful time as well. Thank you. So, for all of you. For you, and Sonia, for you too, and for you guys. You're in the back, modestly.
Thank you.
Thank you very much.
Thank you so much. So, and I also want to support our team at the Office of Strategy and Development, our Director Joan Maurer and my colleague Gustavo Wynn, without whom we won't be able to pull this event. So thank you, and to our technical support team. And now, the best time, enjoy your conversations with our top-notch experts. Thank you.